Welcome to the latest in our series of TopMedTalks 2. In these podcasts, the TopMedTalk team is in conversation with global thought leaders in perioperative care. TopMedTalk.
Well, hello, I'm Desiree Chappell, and this is TopMedTalk. We are live from the European Anesthesiology Congress, Euro Anesthesia 2019, here in Vienna, Austria. And I'm joined by our editor-in-chief, Monty Mythen. Hello, Monty. How are you?
It's good to be here, Desiree. We've had a wonderful meeting, and it's almost at a close. And I must admit, I'm ready to go home. It's been a wonderful time. It's been a fantastic meeting, but we have worked hard, I think.
We have worked hard. We've done lots of interviews that everybody can find on TopMedTalk, and we always like to get those out, just right out.
Yeah.
And then we'll do subsequent podcasts, and you guys can keep up to date with some of that information.
We just got up on the screen behind us one of our excellent interviews we had the other day with Linda Mason, who's the president of the American Society of Anesthesiologists.
Yeah.
Which please do listen to that online. We put a number of different pods up so far, but some good conversations there about some complex issues, including how to look after ourselves and bereavement.
Yeah, definitely. It was a really great conversation. We've actually had the opportunity to catch up with someone else from the ASA who was able to sit down with us, Paul Pomerance. How are you, Paul?
It's great. It's great to be here. This is really a lot of fun. I congratulate you on doing this. I feel like I'm at a live event. And in fact, I'm at a live event. This is great.
What did you think of the game, Paul? The final play?
I think the ref called it wrong.
I was thinking that. Do you think there was no way that was whatever happens in American football that happened?
It hasn't happened ever. But this is really a great service you're doing for people, giving them a great sense of the conference. The list of podcasts is great, and Linda Mason's is the best.
Yeah, of course. Well, it's great. It's all free open access, Paul, so that's really important to us to make sure that we can get medical education out there to the masses, to really a global audience. And so we appreciate that. That means a lot to us.
And that very much we're part of a big tribe of clinicians and providers, payers, patients. You know, we're all in this together.
Yeah.
And that's what we're all about.
Fantastic.
Good stuff. Well, Paul, you guys have some meetings coming up here in the coming year, and we were just wanting to know, can you give us some of the dates for those and what we should expect at the upcoming meetings?
Sure. We have a menu of great meetings coming up. Probably the biggest, the one that's really on our mind right now, is our annual meeting. It'll be in Orlando in October. I think it's October 19th through 23rd. Mm-hmm. It is the biggest event in anesthesiology worldwide.
Say in the world, right? How many people usually are?
We'll get about 15,000, 16,000, and I'll have the top, probably the most diverse educational program. Touches all the subspecialty areas. We'll really feature the newest and best science. The theme this year is all about humanity and bringing the patient and the doctor back together, really building that relationship and putting the patient back at the center. Our keynote speaker, I don't know if Linda mentioned, is Abraham Verghese, and the writer of many books, a physician and humanitarian who writes really deeply about these things. And we're very excited that our Rovenstein lecturer will be the Surgeon General of the U.S., Jerome Adams. So, but aside from that, the meeting, networking, science, a very vibrant exhibit hall, great social events, and it's in Orlando, and so it's a very family-friendly meeting. Yeah. We hope that people will bring their kids. Hope my kids stay far away, but
and very accessible.
Very accessible.
So direct flights from a lot of places
all over the world.
Yeah, so it's a good time. Grasp that opportunity. But you rotate the meeting, Paul, don't you? I mean, I've been a loyal attender for a lot of years now. You rotate around the USA.
We do. Next year, 2020, we'll be in Washington D.C. Which will be great, and we're just working now on the theme and the keynote for that. But that's going to be a great meeting. Washington D.C. in an election year is very vibrant.
Oh my gosh!
And hopefully,
in October.
In October, so it'll be very exciting. And then the year after that, we're in San Diego again, and we move around.
And then back to New Orleans after that. I think
exactly.
Is, enjoy the New Orleans meeting as well.
New Orleans. I love how you say that.
Do I say that? Is that wrong?
No, that's a great.
I've been practicing that for years. Not New Orleans.
No. No.
I feel like I'm there on the streets on Bourbon Street. I mean,
now that's going to be a fun meeting for TopMedTalk.
Our other key meetings are the Conference on Practice Management. That's every January, and that's more of a business meeting.
Is that always in Vegas? Or
for the next 4 years, I'll be in Vegas. People like Vegas, and we're trying it out to see if that might be a home for the meeting. Yeah. But we previously have moved it around, and that's a very strong meeting, but it brings the leaders of the practices and their business people together, and it's more of a business and leadership focus.
And that's the only time where you flip the message to say what goes on in Vegas actually comes home.
Exactly.
Well, 70% of it.
Exactly. Yeah, what happens in Vegas should go home with you.
should go home.
Or at least some of it should go home with you.
And that's a meeting I haven't been to yet, but I've heard a lot about it. That's a meeting where people are gathering and looking at changes in practice, and I presume a lot of discussion now is going to this sort of space of perioperative medicine and all those innovative ideas.
That's exactly right. You know, at ASA, we sort of launched the perioperative surgical home concept at that meeting. Yeah. It did, of course, spread to the scientific meetings and all that, but, you know, a lot of the perioperative surgical home and it's a leadership concept. It's a coordinated care, and so it played a very critical role.
The recurring theme is, that's all a great idea, guys, but how do I go home and get that done? Mm-hmm. How do I make the business case work? How are we going to do that? How do we make it a win-win for everyone? And part of that has to be the business case for team anesthesia, and it's happening now, isn't it? Which is great.
Yeah, I think it's really starting to take off.
And other ones you have, Paul? Other meetings?
Yes, other key meetings. There are two other key meetings. One is our legislative conference, and that's really geared at policy. And that's our major policy conference. We just had it in Washington, D.C. 650 members. A lot of residents go. And it's important in medicine to know how laws get passed, how policy is made, how they connect with lawmakers at the federal and state issue. And, you know, I see this globally, is medicine and particularly anesthesiology is affected by public policy. And you need to have public policy that really favors good patient care, favors the patient, really supports the physician's role. And so that's what we look to help make sure. And then we have a quality meeting. And the quality meeting is usually in the fall, November-ish. And it's a smaller meeting really focused on people really into the science of quality and implementation science and quality improvement.
And we picked up on this with Linda a little bit. You have, I think last year, announced your partnership, maybe it was before that, with the patient safety movement.
That's correct.
Well. So,
correct.
Which is sort of getting a global presence now for these issues.
Yes, yeah. We work, we're a partner organization with the Patient Safety Movement Foundation, and they've provided a good linkage with the healthcare ecosystem, patient groups, other specialties, other interests, and kind of a global perspective. So we very much have enjoyed that partnership.
Now, we came over to meet you in the village. Now, this is the European Society of Anesthesia, and a big piece of real estate over there is the American Society. Is there a message here?
Oh, yeah, we're taking over.
we did our bit in the past. And we were reflecting on the fact that next year's the World Congress.
Yes.
Yeah.
I think you said you're heading up there next to Prague.
Yes, yes. So we're there to scope out, make sure we got the right spot for our delegation that'll be there. It's a very key event in this specialty.
And you have a pre-meeting as well, do you? Do you say or a satellite meeting?
Yes, well, we'll have a satellite meeting. A couple national societies that get together every year. They're called the Common Interest Group, and it's an exchange of ideas, and we meet once a year. So next year that will be in Prague.
Very good, very good. That's great. Well, thank you for the update on all those. We appreciate it, and thank you for sitting down with us.
So this is fun to play with. This is really great.
Great technology, isn't it?
Yeah, this is fun.
And you can imagine we can have everyone out there listening, like, on their headphones listening in, but other people can, because we're live streaming it, they can pop back up to the wherever they go.
I want to get one of these setups for my house. I would be talking more often to my spouse if I could have this kind of...
Well, I have to tell you, Paul, I always tell Monty this is the only technology that I will use on Top Med Talk, because I cannot hear otherwise, and so you can... Exactly. So I think my husband's like, can you get a set of those for at home so you can hear me?
Pay attention.
Brilliant. Fantastic.
Thank you so much, Paul.
Top Med Talk. Nick Majerison here. Thanks for listening to Top Med Talk. Now, before we let you go, it's important that we remind you to subscribe to Top Med Talk. That way you'll never, ever miss another episode. Also, if we could encourage you to join us on social media, Twitter, Facebook, LinkedIn, YouTube, pretty much every single social media platform, we're there. Join us. And finally, check out TopMedTalk.com. If you go to our website, you can subscribe to email updates. That way we can always tell you where we're going to be, what we're going to be doing, and how you can join us. TopMedTalk.com and click on the section marked email updates. Finally, Top Med Talk is proud to act as the broadcasting arm of EBPOM, Evidence-Based Perioperative Medicine. We'd love you to find out more about them as well. ebpom.org is their website. That's ebpom.org. And if you go to ebpom.org/meetings, you can find out about some of the wonderful meetings that we attend and cover across the year here on Top Med Talk. That's ebpom.org/meetings.